On to this now. The South African Medical Association says it's concerned by reports that untrained nurses are being deployed to ICU wards during the pandemic. The association's chairperson, Dr. Angelique Coetzee, says if staff aren't trained properly, it compromises patients' care naturally. We speak to her via Skype now. Thank you very much, Dr. Coetzee, for joining us. So what is an untrained nurse, firstly?
An untrained nurse is a nurse that's not trained for that specific post that she's now put or that is now allocated to her. She's trained, let's say, for an example, to work in a pediatric ward or unit. It can be different post levels, different levels of training that you have, but it's specific to that pediatrics. And what we are seeing now in COVID-19, due to a lack of good training and a lack of staff, we are now facing with people working in ICU or in high care wards that's not properly trained for that ward or that at that level. So the skills are not is not for that. For that service that they are supposed to render. And this puts them in a very dangerous position, as well as the patient, if you look in terms of patient care. Also, please remember, we did ask, SAMA did ask, as well as a lot of doctor groupings, that, in COVID-19 time, if you are working as let's say, take me for an example as a GP, with 33 years of experience, and you put me in ICU to work in ICU because of a lack of doctors in ICU, that I would then be, that there can't be a claim instigated against me because I'm working out of my scope of practice. So far that has not been granted. So we are really, really worried at what we are seeing in a lot of the ICUs and high care. So it's not only nurses that is working, who are working in those facilities without being properly trained, but there's also doctors. And again, if I take myself as an example, if you put me in charge of an ICU, I would not know what to do. I would first need training, although I've got a lot of experience. My experience is not in the field of ICU. It's the same that you ask a surgeon or an ophthalmologist or an eye doctor to run a COVID unit at this stage in ICU. We're not trained for that. That's not where we are trained. So it's not only for doctors, but it's the same for nurses.
That is quite a scary picture that you are painting there, because then that suggests that if somebody goes into hospital, not anyone can just be an ICU nurse, firstly, is what you're saying. Yeah. But if you go into hospital, then you could literally die because you have somebody that is not in the right position to give you that health care. Could that be the reason why we're seeing the number of deaths that we are seeing here? Could there be a correlation?
There might be. I'm not saying there is. There might be. It can contribute to higher deaths or poorer outcomes. I think poorer outcomes is a better word to use here. Because remember, you are expecting of someone to be trained and look after your patient. You as a doctor will come in, do your ward round, give all the instructions, and then you leave. And you carry on with other patients. So you leave the acutely ill patient in the care of a nurse or a sister that's supposed to be trained for that specific level. Also, the ratio, there's a specific ratio of nursing staff or sister per bed in ICU and high care. Currently, that's not happening due to there's not enough staff. And the poor nurses or sisters that's trying their utmost best to cope can't cope because the workloading is too much. And then again, on top of it, they also need to still train and supervise other nursing staff that comes into that unit that's not skilled enough. It's a lot of stress. In this time and age, we do not need any additional stress on doctor. It's not acceptable and it's not right against them. So that is what happens in the private sector. In the public sector, it's more or less the same. So, you know, the president said that all vacancies will be filled. And it's very nice to say all vacancies will be filled. But there's a much darker side to this, because we first need to go and see what is our funded post versus our unfunded post. And this is where the problem comes up, because our unfunded post over the years has been abolished or just restructured. And so that the staffing norms, the current staffing norms that you need to treat patients, especially now in this pandemic, are not there. You know, they are lacking severely. And one of the reasons why these posts, these unfunded posts, were abolished or restructured, as they would call it, was to make their performance indicators might look better on paper, because staffing norm is one of your performance indicators. So if you've got a lower staffing norm, it means you've got enough staff and you look great on paper. But that's not what's happening in the public sector. And we need to urgently look at this whole process of where your staffing norms and your staffing, your organogram, that's been drafted by National Department of Health and by the various provinces, clinics, hospitals, whether that should not come back into the healthcare system and not go to DPSA to fit their organogram. Because if it doesn't fit DPSA's organogram, they will also not allowed or allocate those funded posts. So we need to, we need to seriously go back to the drawing board so that we get enough trained doctors, enough trained sisters at the right level, at the right place, with the right skills, so that we can get this pandemic going on, fighting as it goes on currently. We also ask the President and the Minister of Health to please let us get an investigation going. Let us go and look at what is the problem here with posts that funded and not funded. What happened the past 20 years? What is the staffing norms now? What is needed? What type of training do we need for these nurses? Because you need high-level and high-skilled nurses. We don't have a lot of them in South Africa.
Just very quickly for us, Dr. Coetzee, just how widespread is the problem to your knowledge?
Quite widespread. To our knowledge, widespread. And what, if the the private hospitals, if the managers are being honest and they can tell us, we know what is happening, but if you want the proof, they need to tell us how many nursing staff do they have that is qualified for ICU, working in ICU currently, as well as high care. And we know what is happening. It's the same that someone kept on saying to especially the KwaZulu-Natal and Eastern Cape MECs, you've got a problem. And they kept on telling us we are lying. What do we know? We're not truthful. And, well, we've been proven to be truthful. And there's exactly the same that's happening. And it's not fair. It's not fair against that nursing staff, and it's not fair against the patient. And in the private sector, it's even worse, because the medical schemes are paying for services that's not being rendered by people qualified to do that job.
Scary. The South African Medical Association chairperson, Dr. Angelique Coetzee, thank you for putting us in the picture.